Future nurses, by the end of this video, you will be able to understand the true cause of Cushing syndrome and Addison's disease. So stay with me, and as always, I have endless review on Cushing syndrome and Addison's disease. Go review it at Scrub and Spoon on YouTube. Now let's go. Now I need you to know that both Addison's disease and Cushing syndrome are adrenal gland disorders. Now, Cushing syndrome is the overproduction of the glucocorticoid steroid hormone called cortisol, also known as the stress hormone. Now, why is cortisol stress hormone? You need to understand what is cortisol. Cortisol is released in response to stress. Think of cortisol as body's energy drink. When the body is tired, cortisol helps the body to cope with or manage stress. Cortisol also helps to reduce inflammation. It helps to increase metabolism. It helps to regulate blood pressure and fluid balance. So cortisol is very important. Now there is overproduction of it in Cushing syndrome. Now let's talk about causes of Cushing syndrome. The first one is Cushing disease. Now, what are examples of Cushing disease? Pituitary adenoma, that is pituitary tumor. And how does this cause overproduction of cortisol? It increases the release of ACTH, and that will lead to excess production of cortisol, because increased ACTH will stimulate the adrenal gland to release more cortisol. Another cause of Cushing syndrome is adrenal adenoma, that is adrenal tumor. This will cause overproduction of cortisol. Another cause of Cushing syndrome is small cell lung cancer. Also, exogenous steroids will cause Cushing syndrome, that is steroids from outside the body, exogenous. So, such as long-term use of steroid hormone like prednisone, high dose prednisone for a long time will cause Cushing syndrome. So signs and symptoms of Cushing syndrome. In Cushing syndrome, think about high. Everything is high. Overproduction of cortisol double everything, so everything is high. You will see high blood pressure, hyperglycemia, hypernatremia, truncal obesity, moon face, buffalo hump, purple stray, also known as stretch marks, red face or rosy cheeks, hirsutism, big one on anklets, slow wound healing, anklets worthy, because steroid suppresses the immune system, tachycardia, and risk of osteoporosis. Let's talk about diagnostic tests for Cushing syndrome. The first one is 24 hours urine-free cortisol. And what is this? This is the collection of 24 hours worth of urine to see how much cortisol is released or produced or excreted over that time in the urine. And the next one is dexamethasone suppression test. This is done in two parts. The first one is giving low dose dexamethasone before proceeding to high dose, right? This is giving synthetic glucocorticoid to patients, and the cortisol level is monitored through blood test. Now, during this time, if dexamethasone have no effect on the level of cortisol produced or released, the patient will be diagnosed with Cushing syndrome. That is, if the synthetic glucocorticoid given to the patient does not suppress the production of the release of cortisol in that patient, then that patient will be diagnosed with Cushing syndrome. Because normally dexamethasone should suppress ACTH and lead to suppression of cortisol release. So if this dexamethasone giving does not reduce the release of cortisol, that patient will be diagnosed with Cushing syndrome. MRI scan of the brain may be done to look for pituitary adenoma, that is pituitary tumor. And CT scan of the abdomen can be done to assess for or to look for adrenal adenoma, adrenal tumor. So let's go to the treatment of Cushing syndrome. Just like I said, that one of the causes of Cushing syndrome is exogenous steroid use. So therefore, the initial treatment will be gradual withdrawal of steroid hormone use, such as prednisone. You want to gradually taper the patient off prednisone. The next one is you may want to remove the endogenous cause, that is the removal of the pituitary adenoma, which is known as transphenodial surgery. Another option is also the surgery removal of the adrenal adenoma, that is adrenal tumor. Now, if surgical removal of the underlying causes are not possible, then adrenalectomy may be considered. That is the surgical removal of adrenal glands. But take note, this may lead to adrenal insufficiency, which means patients will be placed on lifelong steroid hormone replacement therapy because the adrenal glands are removed. Medication options that may be considered in Cushing syndrome is ketoconazole, which is an antifungal, right? It can inhibit the stimulation of cortisol. Another medication that can be used in Cushing syndrome is metyrapone. This also reduces cortisol production in the adrenal glands. So it is used for Cushing syndrome. Okay? So guys, that is about Cushing syndrome. Now let's move to Addison's disease. In Addison's disease, there is underproduction of the steroid hormone, particularly the cortisol, which is glucocorticoid, and aldosterone, which is mineralocorticoid. So in Addison's disease, there is low production of these two hormones. These two hormones are important in maintaining body functions, which makes Addison's disease a life-threatening condition. Causes of Addison's disease: damage adrenal glands. This means the problem is with the adrenal glands themselves. And the most common cause of this is autoimmune destruction of the adrenal cortex. This is when the immune system gets confused and attack and damage the adrenal glands. So the key features you will see in Addison's disease are decreased cortisol and decreased aldosterone, low production of both of them. Increased ACTH, which will later be converted and lead to hyperpigmentation. So you see hyperpigmentation in primary Addison's disease. And for the labs, you will see hyperkalemia, hyponatremia, hypoglycemia, because everything is low. And that is why in Addison's disease, you have to add, everything is low. You add salt, add sugar, add sex. Now let's go to secondary adrenal insufficiency. Here, the problem is in the pituitary gland. So causes of problem in pituitary gland, just like I said, the problem is in the pituitary gland. Some causes are pituitary adenoma, that is pituitary tumor. So surgical removal of the pituitary gland will lead to adrenal insufficiency, because pituitary gland surgery removal will decrease ACTH, which will lead to low stimulation of the adrenal glands and insufficient release of cortisol. Now, tertiary adrenal insufficiency. In tertiary, problem is in the hypothalamus, and most common cause is chronic exogenous glucocorticoid therapy suddenly stopped. That is, sudden stop of long-term steroid use. They've been using prednisone or steroid hormones for a long time, and then they stop it abruptly. That will cause problem in the hypothalamus. Other causes could be hypothalamic tumor, head trauma, surgery, or radiation. Now, what really happened is hypothalamus produced inadequate CRH due to suppression because of the exogenous glucocorticoid use. That is long-term treatment with prednisone or long-term use of steroid hormone like prednisone. Now, this makes the hypothalamus believes or think there is too much steroids in the system. Then it shuts off the production of CRH. So inadequate CRH and ACTH will lead to low adrenal stimulation, which will in turn lead to reduced cortisol secretion. So that's what happened with chronic exogenous glucocorticoid hormone therapy use in tertiary adrenal insufficiency. Okay, now signs and symptoms you see in Addison's disease or adrenal insufficiency: everything will be low blood pressure, hyponatremia, alopecia, that is loss of hair, depression, fatigue, they are tired, hypoglycemia, hyperpigmentation, lastly hyperkalemia. And why? Because in Addison's disease there is low production of cortisol and aldosterone. Now, aldosterone is used to help kidney to retain salt and water and helps to lose potassium. Now, the aldosterone is low. The aldosterone that helps the kidney to retain salt and water is low. So that means there is nothing to help retain salt, and that's why there's hyponatremia in Addison's disease. And there is nothing to help excrete potassium. That is, now the potassium is accumulating, and that is why there's hyperkalemia in Addison's disease. Okay, now let's go to diagnostic test of Addison's disease. The standard test is the ACTH stimulation test. And what is this test? A synthetic ACTH will be given to the patient, and patient blood cortisol will be monitored before, 30 minutes and 60 minutes after administration of the synthetic ACTH. Now, in damaged adrenal glands, the ACTH does not stimulate the release of cortisol. So if after the administration of the ACTH and the cortisol level does not double or increase or rise, the patient will be diagnosed with adrenal insufficiency, Addison's disease. Because if the adrenal glands are not damaged, the synthetic ACTH is supposed to cause the rise of cortisol. Also, CT/MRI of the adrenal glands may be done to assess for infection, hemorrhage, or tumor. Okay, now let's move to the treatment. Listen to this. Since the issue in Addison's disease is because of there is low cortisol production and low aldosterone production or stimulation, the treatment will be to replace the missing hormone, which will be hormone replacement. So hydrocortisone, which is the glucocorticoid, fludrocortisone, which is the mineralocorticoid hormone, will be administered. And I need you to know that this will be a lifelong therapy for this patient. Never stop steroids abruptly. It will lead to adrenal insufficiency or Addison'S crisis. Patients should wear medical alert bracelets that will be written, that Addison's disease will be written on it. Patients should also carry injectable hydrocortisone for emergency. Finally, let's go to Addison'S crisis. This is life-threatening emergency due to severe cortisol deficiency. That is, low or absence of the steroid hormone cortisol will lead to this life-threatening condition. Signs and symptoms you will see in Addison'S crisis: low blood pressure, loss of consciousness, or they may experience some neurological symptoms like confusion, hypoglycemia, hyponatremia, and hyperkalemia. Now, what are the triggers, or what can trigger Addison'S crisis? Stress, infection, trauma, and sickness. And so this is why patients are encouraged to inform their healthcare provider when they are going through stress, so that the steroids can be increased. This is called stress dosing. Now let's talk about management or treatment. The first one is IV hydrocortisone to replace the missing hormone, because that is why they are in Addison'S crisis state. So they need to replace the missing hormone, the cortisol and the aldosterone. Next management is IV fluids, 0.9 normal saline bolus, rapid infusion. And also IV dextrose can be added if there is presence of hypoglycemia. Lastly, fluid and electrolyte monitoring is important in patients with Addison'S crisis, especially monitoring hyperkalemia. Now I know you know the differences between Cushing syndrome and Addison's disease. Bye.